So
you can continue.
Okay, fine, thank you. So I'll request all of us to kindly mute their mics, and if you have any questions during the lecture, you can always post it on the chat box, and I will address them after the lecture or even in the middle of the presentation. My name's Miss Mutai. I'm a microbiologist, and I'll be taking you through a few sessions in bacteriology and also mycology. So today we are going to discuss staphylococcus and micrococcus, which is basically just an introduction to what we call systematic bacteriology. So where you look at the different bacterial pathogens, you discuss their structure in terms of how they appear. You also discuss some epidemiological dynamics, how they're transmitted, how they cause infections, how they are treated and managed. Okay, so that's the whole aspect of systematic bacteriology. So you look at each and every, the different genuses, and then within the different genuses, you look at the different, a few of the most important species that are associated with the clinical infections. So today we are going to cover staphylococcus and micrococcus, which are really key. I'm sure you've covered this when you're looking at normal flora, and you were told that staphylococcus and micrococcus are mainly found as normal inhabitants of either the skin or even the mucosal surfaces. So that's how the staphylococcus and micrococcus are classified. So I've just started from the family level. They're classified under micrococci, and then within the genus, that's where now you have the staphylococcus and micrococcus. Among the most important species, we have Staphylococcus epidermidis, Saprophyticus, aureus, and Laetus, but which is what we are going to put most emphasis on. But if you look at the genus Staphylococcus, we have up to 200 species, but we're just going to focus on these three because of their medical importance. Sorry. So we'll start with the genus Staphylococcus, which are mainly classified as gram-positive cocci. And the gram-positive cocci, they're usually arranged in a cluster. Okay, so they appear as a grape-like, in just cocci attached together in a cluster. And like I'd mentioned, you find that they're mostly normal inhabitants of either the skin and the mucosal surfaces. And this makes them important in terms of causing nosocomial infections. Because remember, the infections will result, especially when these colonizing strains enter a sterile site, either as a result of trauma or abrasion, through the skin or even through the mucosal surface, mostly through invasive procedures. Okay. In terms of differentiating now Staphylococcus, let's say from Streptococcus, they produce catalase enzyme, and this now aids microbiologists when you want to, let's say you have a mixed infection. How would you know this is a Staphylococcus and not a Streptococcus? So the first test that you can perform is catalase test to enable you to differentiate the two. So this is how they appear on a gram stain. So when you stain your specimen or even your culture with the gram stain, you will see the gram-positive cocci that attached together, like I'd mentioned. So which are some of them? Am I too fast or you're okay?
We okay.
Okay, fine.
Okay.
So, okay. So, like I said, we have different species of staphylococcus, and how then do we differentiate? So there's one broad way of differentiating the staphylococcus species. So we use what we call the ability of the pathogen to produce coagulase enzyme. So among the staphylococcus species, we have those that produce coagulase enzyme and then those that do not produce coagulase enzyme. So the three species I talked about, that's Staphylococcus aureus, Epidermidis, and Saprophyticus. The Staphylococcus aureus is the one that is able to produce coagulase. So we call it coagulase positive Staphylococcus or COPS. And then the one that doesn't produce the coagulase enzyme, we call them, classify them under coagulase negative Staphylococcus species. That's the cons. And here we have the Staphylococcus epidermidis and Staphylococcus saprophyticus. So you will see that, from the first layer where we're saying that once you've differentiated the streptococcus, the staphylococcus from the streptococcus, then your next step now would be to use the coagulase test to differentiate among the staphylococcus species. And here now you'll be able to separate the Staphylococcus aureus from the other Staphylococcus species. So let's start by looking at Staphylococcus